Hello, my name is Adam Riedel. This is my BSN346 Healthy Pregnancy Prenatal Education video. So we're going to kind of discuss what to go over with a patient that's going to be having an uncomplicated pregnancy. First and foremost, if this is their appointment, I would be introducing myself, letting them know who I am, asking their name, date of birth, and then washing my hands, closing the door for privacy, and all of those sort of things to make the patient more comfortable. So first things first, the first appointment that the patient, the mother and the father are going to have, you're going to want to go over kind of and educate them on the entire experience of the whole prenatal journey that they're going to be taking. Like I said, for an uncomplicated, we're going to be talking about this as kind of an uncomplicated pregnancy. So for the first 32 weeks, you're going to have monthly appointments. From 32 to 36 weeks, it's going to be every other week, or so every 2 weeks from 32 to 36 weeks. And from 36 weeks to the birth of the baby, you're going to want to typically have a weekly appointment for that. So it increases as you go on. So during a lot of these testings, a lot of these appointments, you're going to do different testing. So for example, the very first visit, the first prenatal visit, you're going to want to do an RH factor test, which that's going to determine the baby's RH factor and the blood typing of the mother and the father. If the mother is negative and the father is positive, there's a potential that the baby might have an RH factor, and that's going to potentially be indicative of needing to administer RhoGAM or not to the mother, which would help prevent any issues with further pregnancies. The first one's a little bit of a gimme because once the baby's born, that blood-brain barrier, or that blood barriers, the blood is mixed between them, and that's when the antibodies would be developed from the mother. So the first baby doesn't really have too much of an issue, even if they're different RH factors. Anywho, at 20 weeks, you're going to want to do an ultrasound of the baby, and that's going to be making sure that the organs are developing correctly when they need to be, and if there might be any potential issues early on in the pregnancy. From 24 to 28 weeks, you're going to want to be doing the glucose tolerancy test, and that's going to determine if the mother is having potential issues or complications with acquiring gestational diabetes, which in that case you might have to do certain nursing interventions to make sure that mother is staying safe during her pregnancy, because there will be a little bit more complications in that regard because of the fact that they now have diabetes during gestation pregnancy. From 35 to 37 weeks, you're going to want to administer a Group B streptococcus test, and that's going to determine, and that's just important because that can be passed to the fetus, that certain group of strep, and that can cause serious infections in newborns, and obviously that's something you would want to avoid. Another test that you're going to do is the nuptial translucency test from 11 to 14 weeks. That's going to measure the folds and nuptial, I can never say that word right, nuptial folds on the unborn fetus's neck, and that's going to be an indicator of potential genetic issues or potential Down syndrome acquiring. During all of these appointments too that you're in, you're going to also want to obviously be checking the weight of the mother, seeing if that changed, the fetal heart rate, as well as the fundal height as well. And when you're doing the weight, it would also be important to kind of educate them on the expected weight gain, a healthy amount of weight gain that mother is going to potentially have, and that's going to be based on their BMI. So for example, overarching, if you're more underweight, you're going to be expected to be gaining more weight during pregnancy. If you're overweight or you have a higher BMI, then you're going to be expected to gain less weight during pregnancy. So like, for example, if you're over 30 with your BMI, we're only going to want you to, gain 11 to 20-ish pounds during the course of that pregnancy. And from 18, you're going to want to gain more like 28 to 40 potential pounds, which is a decent amount of weight, but those are the underweight mothers at that point. And you're going to also want to help anyone increase their caloric intake due to the fact that you're kind of now eating for two. Decreasing your sugar and decreasing your saturated fats is also going to be something you want to educate them. Sugar, that's kind of an obvious one. That's going to just be helpful to help decrease the risk of acquiring gestational diabetes. Another thing too is you would want to have them potentially or recommend them to take an iron supplement, especially due to just increased potential of anemia because of the potential more bleeding that they're going to be having, as well as something like a calcium supplement, like a multivitamin would be super helpful, as well as telling them it'd be beneficial to increase their folic acid, taking a folic acid supplement. That's going to help with neural tube defects. And during that as well, which kind of is going to go into what we're going to be talking about next, is you'd want to make sure that their fiber is going to be increasing and that they're going to be having good hydration throughout the entire pregnancy. So in terms of educating for exercise, basically high impact is a no-no, low impact is a good thing to do. So like running is bad, lifting weights, things that are going to be really strenuous on that mother, things like that are going to be something that you want to avoid, obviously. But things such as yoga or walking, things that are low impact, are going to be beneficial for you and that baby, or for the mother and for the baby. Some common complaints that you're going to be expecting to see during pregnancy, the number one is going to be nausea, vomiting, and morning sickness is going to be something that they're going to potentially be experiencing. Something to help with that is just increasing fluid intake and eating something bland potentially in the morning. That could help kind of ease the stomach out a little bit. Fatigue is going to be something that's going to be really common as well, but still do those low impact exercises. Don't just become bedridden. That's going to be detrimental to your health and potentially the fetuses. Just take periodic breaks while you're doing exercises, things of that nature. Just take little breaks throughout the day. And then another common complaint is going to be constipation. That goes with education of nutrition. Increasing your fiber and increasing your water is going to help prevent that or make that a little bit less of an issue. And then finally, you're going to want to let them know things to watch out for and things that you're going to want them to go to the ER or call the provider immediately. Is going to be bleeding. Especially after like 28 weeks, you're going to want to make sure that you're not bleeding heavily, because that's a big potential indicator of a missed AB or potential miscarriage, and you don't want to have that happen. So that's a big thing to watch out for. Another big important thing that you're going to want to go to the hospital for potentially is hyperemesis gravidium, and that's going to be just basically uncontrolled vomiting. That's going to be very sketchy because you can have malnutrition and become dehydrated, and it might be harder for you to keep yourself hydrated, especially when you're just continuously throwing things up. So it's going to be important for you to potentially get supplementation and help in hospital for that. So hyperemesis gravidium is something that they want to watch out for. And then finally, another thing too would be placenta eruption, and that's going to be really, really dark bleeding and abdominal pain, and that's going to be super fatal very quickly for the mother and the baby. So that's an ER visit, 911, emergency right then. Obviously, that's a lot of information. There would potentially be a packet that they would be going home with, and they would be able to go over all of these things after the fact at further future visits as well. If they ever had any questions, this would be the time to answer any questions that they potentially had, and that is it. Thank you very much.